TAF Africa, Koyo engages media practitioners on disability rights. Stakeholders in disability rights and inclusive development have called for stronger enforcement and implementation of disability laws in Delta State, urging governments and institutions to move beyond sympathy toward deliberate policies, accessible infrastructure, and inclusive mindsets. The call was made at a two-day media engagement, Advocacy and Journalists Training on Disability Inclusion and Rights, organized by TAF Africa under the Disability Rights Advocacy Project for Inclusive Development, the RAPID, in Asaba. The representatives of TAF and Koyo has this to say.
My name is Mark Fresk.
Okay, Mark what?
Mark Fresk. It's a difficult one. It rhymes with desk,
Okay.
but it looks like it should be fresh.
Okay.
So I represent a company. We originated in the UK, but we have a company based in and for Nigeria, which aspires to. We have created an app, and the idea is a text-based app to make healthcare more accessible for the people of Nigeria, Delta State, and other states also. We have the app now, and we've created a thing, and we now need to tell people about it.
Okay.
So we've linked in with TAF, and we have a great collaboration with them around people with disabilities and access for the app. The app is called Koyo, and that's a Hausa word meaning learning or to learn. Because our journey, we are doctors, most of us, by training and by interest, and our idea is to make healthcare more accessible and more affordable, to improve people's healthcare journey and access to care. And that's particularly relevant for marginalised groups, for people with lower incomes, and particularly for people with disabilities. At the moment we have registered live Nigerian doctors communicating with Nigerian patients.
Sure thing. So my name's Dr. Tom Cracknell. I'm a medical doctor, specialty in emergencies. I've worked a lot clinically across West Africa and in Nigeria, and I'm here because we have built a digital health platform, AI enabled, to improve access to healthcare information for the people of Nigeria, with a specific focus on persons with disabilities. A universal right to good healthcare information, to truthful healthcare information, accurate quality healthcare information. With our platform, with our Nigerian clinical team who are excellent, we are building an AI system that can deliver that at really affordable prices. So we can scale to hundreds of thousands, millions of users while retaining an affordable price, which is what really matters to us, because we're focusing on persons with disabilities, but we are also looking to catalyze access to good healthcare information for everyone.
What I'll say is it's important, people put empathy and compassion in anything they do, in all social services, health, education, and all that. So for us in Koyo, what we focus on is training our doctor, ensuring they have the right communication skills to demonstrate empathy, compassion for their patients. They connect with them and they build trust. This is what ensures that the patient, gets the best care. Sometimes care doesn't really lead to medicine. Sometimes you just need somebody that can listen to you, that understands you, and is able to provide that information and guidance you need.
Taking a strong position on education policy, Dr. J.K. Pele, founder and CEO of TAF Africa, criticized segregated schooling, describing so-called special schools as inconsistent with inclusive development.
Our desire is to have an inclusive governance for inclusion of persons with disability. And so as a champion of disability, every opportunity to do so is a welcome development. That's why I'm here. I'm here to push for inclusion. So the society is dynamic. However, the initial idea of special school was a welcome development. And so today, the idea of a special school is no longer tenable. It's against the principle of inclusion. Therefore, if you're a parent and you're pushing to send your child to special schools, that's not the practice of today. Push to send the child to the mainstream school and let that child be integrated. So the idea is to integrate persons with disability who have been isolated for a very long time into the mainstream scheme of things.
Participants had the training collectively called for full implementation of disability laws and the full implementation of the at least 5% employment quota for persons with disability in every recruitment exercise across the state. The training brought together journalists, persons with disability, advocates, and development partners to strengthen ethical, right-based reporting and promote inclusive development in Delta State.